I would like to normalize this conversation about this taboo topic. I'm not sure if you can guess what I'm going to talk about, but very soon I will reveal it to you. Welcome back to Athena Women's Clinic YouTube channel. I'm Dr. Kasoma. Today we'll be talking about something called prolapse. I'm sure most women would have heard about it, but probably unsure if it is actually happening to them. It is not a topic that is related only to older age group. It can happen to any woman. So what does prolapse mean? So let's say, for example, if we cut a female body into half, we can see the front is the anterior abdominal wall, then we have the bladder, then we have the uterus, then behind the uterus is the rectum, and behind that is the sacral bone or vertebrae, and then you have the posterior wall. So that's how the structures would look like. Now there's normally a muscle called pelvic floor muscle, which is like a little hammock that goes, it goes all around, right from the front pubic symphysis bone to the sacral bone at the back. So it holds all these three organs. So the bladder, the uterus and the rectum. So it's supported so that obviously it shouldn't fall off when you're standing up, otherwise gravity will pull it down. So to prevent that from happening, this muscle has to work itself up and provide that support like a hammock. So what happens in prolapse? So if there is issues with the hammock muscle that we just spoke about, or if there is thinning of the support that's provided by the vaginal walls to the bladder in the front or to the rectum at the back, then these organs can start falling down. So the common way that someone would feel it is with either urinary incontinence, or there could be like a little lump that can be felt in the vagina. So we have just learned what prolapse is. So the next question obviously would be, what are the reasons for the prolapse? Now, bearing in mind, this can happen to any woman who has either had children or not. So there is inherent muscle weakness that contributes, worsened by vaginal childbirth. Obviously, the head of a baby is not a small organ that's coming out. So that stretches the muscle and tears the muscle sometimes. And unfortunately, the recovery is not to its original state, which is when this happens. Now, apart from these two main factors, of course, age and menopause. You know what? Women are talking about menopause like there's no tomorrow. So definitely that's another cause. Again, hormonal influences, hormonal changes during menopause can also influence the muscle strength, the vaginal wall strength, and if they're not there, then you end up having a prolapse. We just learned about the brief anatomy of what the pelvis is. So now let's just break it down a little bit further to understand what are the types of prolapse. So most women understand that prolapse means that the uterus is falling out, isn't it? But you need to know that that's not the only situation. The uterus may still be in its position. The bladder may fall back and lose its strength and fall into the vagina. That's called a cystocele. If it is the rectum that the strength, the back wall of the vagina, if it has lost strength and the rectum is falling forward, it's called a rectocele. Now, obviously, if the uterus along with the cervix is coming down, depending on where it is, it can be classified into different grades of prolapse. So cystocele, rectocele, and uterine prolapse. Now that you have learned what are the types of prolapse, you might ask, what would a woman feel, or what should I be feeling if I do have a prolapse? Now, 90% of the times in early stages, you may not feel anything. But occasionally there will be small symptoms like, you may lose a little bit of urine when you're coughing or sneezing, or you may feel a little lump. Or sometimes you may feel that you've not emptied your rectum completely. Sometimes you may feel heaviness or pressure in the vagina. Occasionally there can be pain that may be associated because of the prolapse. As always, and I've always mentioned this in my videos, that if you are struggling with any of this, it is important that you seek help from your own healthcare professional, or you can visit us at athenawomensclinic.com.au for a comprehensive examination and advice. As always, the next question would be, how do I prevent? Well, just like how you go to the gym to work your muscles like biceps or triceps, similarly, start early and start exercising your pelvic floor muscles. There are again lots of options available. but choose what suits you. So pelvic floor exercises, or otherwise called as Kegels exercises, there are devices that are available to help you do them, because we all forget to do it. Yes, we go see the physio, we learn it. Unfortunately, 99% of us do not put it to practice. So it's really important that you get on and do that. Include that as a part of your gym training every day if that's something that you do, so it becomes your routine. Precipitating factors like constipation, chronic cough, or raised intra-abdominal pressure, or if you're heavier in the tummy, all this can also lead to prolapse. So if you're able to modify these factors, that would reduce the chances of prolapse. What are your treatment options? We've just discussed the non-medical treatment options, but if you're looking at medical options, then we have some things like pessary, which can help you provide temporary relief, but it has to be combined with the physiotherapy advice and the Kegels exercises. Otherwise, surgical option is available to you. That would depend on the degree of prolapse and the degree of your own symptoms. So definitely a healthcare professional advice is really important there. Now, the latest treatments that is available is the radiofrequency treatments. I would encourage you to go and look at our videos that is related to the radiofrequency treatment to educate yourself. So I'm hoping that this video has given you a little bit of insight into what prolapse is and what your management options that are available. And I'm hoping that that would empower you to take appropriate steps and care that you need, if not to seek advice from your own healthcare professional. Thank you for watching the video.